Okay, today we have in week 8 administration of parenteral medications, unit 13. One of the objectives are measuring medication in a syringe, administration of injections, DVD, preparing a patient for an injection, patient assessment, site selection, and administration of
Professor,
intramuscular, subcutaneous, and ID injections. What's up?
no, forget it.
All right. So let's start with the PowerPoint. Unit 13, administration of parenteral medications. That means medications, injection medications, or injected medications. In the introduction, we have different type of injections or parenteral medications like intravenous, that is the fastest effect. You know by logic that the medication goes straight to the blood torrent when it's introduced into the veins. Also, we have the intramuscular parenteral medication, that is the next fastest effect. The medication injected through the muscles, for example, in the deltoid muscle for immunization, or in the thigh muscle for small patients, like from newborns to the first 2 years old, and in the gluteus for other medications like painkillers and penicillin, for example, and also the subcutaneous that have a slower effect that is used. A perfect example is insulin. Advantages of the parenteral route. In the parenteral route or in the injection route, you have an effective delivery when the oral route is difficult or impossible. Not this type of medication is not altered by gastric acids, not lost from vomiting, and the delivery of precise amount of medication to target area is more precise. You have some disadvantages of the parenteral route, like the risk of infection due to incorrect preparation of equipment, poor technique. There is a specific technique that we can review some videos on YouTube for doing the intravenous medication, the intramuscular medication, the subcutaneous medication, because you gotta be careful of not damaging the nerves. For example, the sciatic nerve that crosses the gluteus muscle, and the nerves in the deltoid too, and also the right technique for doing intravenous medication, how to, in what angle to place the needle, and the asepsis and the hygiene that you need to have when you're applying this type of injections. Allergic reactions may occur more quickly or be more severe than with oral medication, because the absorption of the medication is quicker. Also, another disadvantage is that injection can cause injury to tissue, nerves, as we mentioned before, and blood vessels. The needle can strike a bone in geriatric or pediatric patients, and can cause hematoma, as you have experienced maybe by yourselves or in your jobs at a medical practice or in a hospital. that after doing a blood work, a regular CBC, you can have an hematoma in your arm. It goes away in a few days, but it's a little bit impressive when you get an hematoma in your arm because the arm turns purple or blue, and it's not so pleasant to have an hematoma, and the pain too. Preparing the patient for an injection. First thing, establishing a rapport. Be courteous and professional. Give patient chance to ask questions. Provide privacy. Never tell patient injection will not hurt. Educate about the side effects. And try to engage professionally with the patient so the patient can feel comfortable and protected and secure. Second, patient assessment. For patient assessment, you need to take into account the age and size. The body size may determine size of the needle or amount of medication to be injected. The physical and mental condition. Consider other conditions such as hemophilia or pregnancy too. And also asking the patient if he's allergic to any medication. That's really important. For physical and mental condition, sometimes you need an assistant to help you hold the patient. This is needed mostly with kids that are scared of the needles, and maybe you will need the assistance of the parents or the assistance of another staff. Sometimes if the parent is too nervous, so sometimes you need to ask the parent if he agrees to go outside of the room where you're doing the phlebotomy or the injection, because some parents are too nervous, too preoccupied because of these procedures. So sometimes one of the parents have to step out. Site selection. It could be a subcutaneous injection. If it's subcutaneous, it's given at an angle of 45 degrees, just below the surface of the skin in the following locations. This is done for the perfect example, as I said before, is the insulin injection. It could be in the abdomen area, upper thigh, upper arms, lower back, and upper buttock. The most important thing is a 45 degrees injection. 45, something like this. But we will see a video about techniques of doing injections. It's something very basic for your careers. Continuing with site selection, intramuscular. If it's intramuscular, the injection is given at 90 degrees angle. 90-degree angle. A 90-degree angle is something like is perpendicular to the surface that you're injecting. This is not the muscle. Well, here or in the gluteus, you have to do it like this. So one classical site and an ideal place to do it is dorsal gluteal, in the upper outer quadrant of the buttock. So you have one gluteus, you have two gluteus, you choose one. For example, this is the right gluteus here, and you have to divide the gluteus in, like with a cross, in four quadrants. And you're gonna choose to do the injection in the upper external quadrant. so you don't damage the sciatic nerve. We will see a video explaining this more in detail. Its use, the intramuscular site selection, is used for most adults for deep intramuscular injections. It's contraindicated for infants. Also, you have the vastus lateralis, that is the preferred site for infants and children. The thigh muscle is preferred for infant and children's. Injection site depends on age of the patient. Site selection, if it's ventrogluteal, may be used for any age, relatively free of major nerves and vessels. Also, the deltoid, the shoulder, is used for adults and children. It's contraindicated for infants. Continuing with site selection, intradermal is given at an angle between 10 and 15 degrees within the epidermal layer of the skin, in the inner forearm, middle of the back, or in the vastus lateralis. The vastus lateralis is the preferred site for infants and children, also used for adults. The injection site depends on age of patient. Basic guidelines for the administration of injections. Number 1, adhere to the 6 rights of proper drug administration. Number 2, select appropriate needle syringe unit. Number 3, properly prepare supplies, medication, and patient. Number 4, for subcutaneous and intramuscular injections, use quick dark light motion. Number 5, aspirate. We're gonna see this in a video to make sure that you are not, when you're doing intramuscular and subcutaneous, that you don't place the needle in a blood vessel, like in an artery or vein, because the goal is to place the needle in the muscle or in the skin or under the skin. When they say dart like motion, like be quick, is that don't take too long when you're doing this, so the patient don't get more nervous. Like, try to do it in a good pace. Continuing with basic guidelines for administration of injections. Number 6, remove the needle quickly and smoothly. Massage the site for most injections. Observe the patient for reactions and document properly. It's good to have the patient in observation for a few minutes, just to find out if there is any allergic reaction coming. Z-track methods of intramuscular injections are used for medications that can be irritating to subcutaneous tissue, may be used to decrease pain caused by certain medications, and is recommended the recommended site is the dorsal gluteal site. Continuing with C-track methods of intramuscular injections. Change needle after drawing medication into syringe. Pull skin laterally away from injection site. Wait 10 seconds to remove needle after injection, and remove needle at same angle as insertion. Do not massage the site in these cases. Insulin and non-insulin injectable medicines. Never shake bottle. Use correct insulin syringe. Rotate sides. Do not massage side. Ensure insulins are compatible prior to mixing. Principles of intravenous therapy, IV therapy. Administration of fluid solutions, electrolytes, nutrients, or medications by the venous route. Advantages of this type of route. It's a direct medication route. You have immediate delivery, absorption into bloodstream. It's reliable for unconscious, nauseated, or vomiting patients. And last slide, principles of intravenous therapy disadvantages. First, you have a fluid overload. You can have air embolism in the veins. Septicemia, you can pass an infection because you are in direct contact with the tissue. Infection, infiltration, phlebitis, thrombophlebitis, hematoma, clotting, pain and discomfort, and hypersensitivity reaction. Well, this is all about the PowerPoint of today, about chapter 13. Administration of parenteral medications. Let's check a short video about techniques of applying intravenous and intramuscular injections, and even the subcutaneous. Well, let's see these 45 minutes about how to give an intramuscular injection, ventrogluteal, buttock muscle.
Nursing students have a saying, the struggle is real. Only another nursing student.
Hey everyone, this is Sarah with RegisteredNurseRN.com, and today I'm going to show you how to give an injection in the ventrogluteal muscle. Here I have Miss Smith. She is our mannequin, and we're going to give her an injection in the side. First, what you want to do is you want to get your patient on their left or right side. Miss Smith is on her left side, so we get her prepped for that. And you draw up your medication, you do hand hygiene, and what you do, the key to giving these injections is finding your landmarks. It's very important you know what landmarks to look for when giving these injections in the muscle, because you want to avoid nerves and any great vessels. So for the ventrogluteal, we are going to find our great trochanter. So we have her on her left side, so we're going to take her hand closest to the patient, and we're going to put our palm on the great trochanter. So about right there. Then you're going to take your index finger and you're going to point it towards the anterior superior iliac spine, which is about right there. Then you're going to take your three fingers and put them together and keep your index finger straight, and you're going to form a little V. And in between that V is where we're going to go for our injection. So keep your hand like that. Take your alcohol prep and clean the site very well. Any germs in a circular motion for about 3 to 5 seconds. You're going to get your injection. I like to take my cap off in between my fingers, and you're going to go in at a 90-degree angle, okay? Of course, you aspirate because it is in the muscle. You want to make sure you're not in any vessels. You aspirate. When you have no blood, that's a good sign. And then you're going to inject. Hold it there just for a second to let all that get in there. And you're going to take out and and gauge your safety on your needle and just put a little gauze or band-aid over to prevent any bleeding. And that is how you give an injection in the ventrogluteal muscle. Next, be sure to check out my video on how to give an injection in the dorsal.
Well, this was how to give an intramuscular injection, ventrogluteal, buttock muscle. Let's check the technique for intravenous injection. Intravenous cannulation, OSCE guide.
We're got. Hi there, I'm Andrew, one of the final year medical students. Could I confirm your name and date of birth, please?
Sure, it's James, 13th of December 1989.
Nice to meet you, James. Today I've been asked to insert a cannula into your arm. It's a small plastic tube that will allow us to give fluids and medication. It might be a bit uncomfortable, but it won't be painful. Is that okay?
Yes, it is, yeah.
Brilliant. Are you allergic to anything at all?
No, not that, no.
Fantastic. I'll just gather my equipment and then we'll begin. If you could just lift your arms up for me, James. Okay, James, sharp scratch. James, I'm just going to flush the cannula now. Do let me know if there's any pain. Thank you, James. We're all done. Are you feeling okay?
Yes, I am. Thank you.
Okay, brilliant. Thank you.
Well, this was the perfect example of the right technique for intravenous injection, explained step by step. Let's see a last video of subcutaneous injection. How to give a subcutaneous injection shot.
Hello, I'm Amber Dart. I'm one of the pharmacists here at Leesburg Pharmacy, and today I'm going to show you how to administer a sub-Q administration, which is subcutaneous or under the skin. As you know, we have other videos, one of which will show you how to withdraw the contents of your medication into a syringe. So this is assuming you've got everything all prepared, ready for your injection. The supplies you're going to make sure you have on hand is an alcohol swab. You would also have a Band-Aid, possibly a cotton ball or a 2x2 gauze, just in case you might need it, as well as the dose that you've prepared for the injection. Keeping in mind that the syringe, the needle length, as well as the appearance, color, consistency of the dose that you've prepared may look different from the one that I'm using for today. So we have Sherry with us today, and she's going to be getting a sub-Q administration of a B12 shot. So some of the sites of locations where you could inject it would be the back of the arm. You could also do your abdomen, around your belly button area. On the lateral side of your thigh would be another area if you're self-administering. Obviously, I'm showing you how to do the injection today, me administering onto another patient, so it is a little bit different. But keep in mind that there are some other areas that you could inject the dose. So we'll have her just have her sleeve rolled up, and we are going to inject in the back side of her arm here. So typically in the area around this area, okay? The idea is that you do not want to get it into the muscle. So when in doubt, you can always just kind of look at the muscle, which is usually the deltoid muscle here, and you would want to inject in the area right below that on the back side of the arm. So to prepare for the injection, where you think you may inject, you're going to start at that center point, and you're going to swirl around when you're swabbing the area. So that's taking any dirt or bacteria away from the site of the injection. I have my cotton ball ready, for those of you that would be using that. And I'm going to have my syringe ready, taking the cap off very quickly, pulling the cap away from me so I don't prick myself with that needle. And then just kind of hold it like a pencil, and you're going to have it, your hands pinched around the area that you're going to inject, and you're going to hold the needle at a 45-degree angle, and you're going to insert the needle, and then slowly inject the medication. By doing it slowly, it doesn't cause as much pain for the patient. And then you'll put your syringe into a sharps container if you have that on hand at home. Just hold the cotton ball at the area there. Typically for a sub-Q injection, you don't see any bleeding, but just in case you want to have that cotton ball ready. And then you can place the Band-Aid in the area if you wanted to put the Band-Aid there. And then that's it. That's the sub-Q administration.
Well, this is all for these videos.
This video is a refresher for pharmacists